question from Sami Sharif. He says, going back to the point of who should pay for interoperability, he understands the efficiencies in the healthcare systems and what interoperability can save for the patients, insurance companies, and such. Always goes back to what is in it for me. And how would interoperability really, help healthcare providers? As you know, they have targets and generate profits. Thus, they want that extra scan or extra consultation. So interoperability can help healthcare providers, and I want that like a little bit to just modify this a little bit. That there's a difference also between the incentives of the healthcare systems and the healthcare providers. And the healthcare provider is really incentivized by providing better care. I don't think providers, being one of them, or at least a former one, are business people. So I don't think providers are always, at least not primarily, thinking of that extra scan. They are forced to by healthcare systems, but that's, I think, a great incentives for healthcare systems. If you can, if interoperability will allow you to get more business.
Well, the question here from is it Sami?
Sami Sharif, yeah.
Yeah, Sami's question is relevant because a supply-based healthcare system does generate more cost than is absolutely necessary, and that's why around the world healthcare systems are now looking at outcome-based payment schedules. So where you don't pay for the number of treatments that you do, but where you're paid for the healthcare benefits that you are able to provide. And actually, for this to happen, FHIR is extremely important because you need to have data to actually measure the outcome. Mm-hmm. So I think this is a good point, and it's being recognized by a lot of people in governments and health systems around the world that we need a change in funding of healthcare to improve healthcare.
Yeah, I agree. Now, yeah, with the especially in America, we're talking about like these MIPS incentives and stuff. Again, like healthcare systems are the ones that want to do it, but I think, building on that question, like providers also want the story, like they want the patient narrative, even if their incentive is to provide better care. They really care about that and knowing that. So we'll take another question, and there is a question from Basant asking how do we minimize the disparities between countries when it comes to AI? And I believe FHIR is the precursor to AI. And interoperability, but how do we move forward with EMRs in developing countries where it isn't yet implemented? And Basant says, unfortunately, but my opinion is that it's kind of a fortunate thing, because when we look at the States, we look at it as a good example, but it's actually like a really bad example, right, of interoperability, because we've put a lot of like technology in place, but didn't really figure out this interoperability first. So, to rephrase Basant's question, for a country like Egypt with 9%, I think, penetration rate for EMRs, we're still in the very early stages. Do we have an opportunity to do things differently?
Yeah, so it's you don't have the legacy, so you can do it right the first time. Yeah. Yeah.
How would we go about that, though? Like, do you create, a task force? Because we're also, a lot of these hospitals, even the 9%, are buying technology from outside of Egypt. So it's not like you can control that too. Like the biggest hospital chain has an EMR from Tunisia. So it's like, how do you do that? Like, how do you learn from other countries in Africa and in the Middle East to be able to actually, you don't have to like reinvent the wheel, like you said. So yeah, you use H.7, but also how do you make sure that you get it right from the first time? Like what models or what lessons?
I wish I knew, Omar, but I think that the opportunity to learn about what's going on in other countries is now bigger than it's ever been, right? We're having this webinar. It's all online. We will do dev days online. There's tons of YouTube videos about FHIR on our dev days channel on YouTube for free. So there's a lot of opportunity to learn about other countries, far more than there were, let's say, 10 years ago. There's so much information now, and I think it all starts with information sharing and learning from other experiences. Having said that, it's that this is not an easy job, right? I mean, it's always kind of difficult to set it up right, even if you have a greenfield situation. But what I would like to see is if you look at the so we run this platform called simplifyr.net, and we see users signing up from all over the world. But we can see where FHIR is being adopted and where it isn't, or it isn't yet. And I think if you look at the Middle East and Africa, there's still a lot to win there, and that's what we try to achieve as the FHIR community. And it's also something that is high on the wish list of the FHIR leadership, but that'll take time.